Dr. Daniel Frank is with me. He's the lead of Southwest Medical Associates Lifestyle Centers, and we're talking about falls. We're talking about fall prevention. Explain to the audience what kind of exercises they can do to improve their balance, their gait, their stability.
So I think that that's a good point. As a matter of fact, regular exercise can reduce your risk of fall by about 25 to 30%. So that's another way you can make an impact. Exercise to reduce your risk of falls, it doesn't have to be going to the gym. It doesn't have to be a 2 or 3 hour program a day. We know that just 2 to 3 sessions a week of 10 to 15 minutes, a combination of aerobic, meaning things like walking or swimming, and some very simple balance exercises can make that impact. So I like to tell my patients to try a very simple, what I call a chair program. So all you need is a single chair with 2 good sturdy arms. And one exercise you can do is just make like you're going to get up from the chair. Use your hands to support you if you need to, and just come to an initial standing position, not even all the way up, and then come back down. Do that 10, 15 times in the morning. That in itself will strengthen the quads, will strengthen the lower back, and help improve your gait and balance. Another simple variation on that is to get behind the chair, use the chair for support, roll back on your heels, and then roll forward onto your toes. Again, using the chair for the support. A third equally simple one is to, holding onto the back of the chair, kind of do a very shallow knee bend. So just come on down a few inches and stand right back up. And so these types of exercises, very, very, very simple. They're going to strengthen your muscle groups, which will reduce your risk of falls, and they really do a lot to improve your balance and your gait as you're going through this. Very simple.
Does simple walking help?
Walking helps so far as the fact that it's an aerobic exercise, and aerobic exercise helps. Walking itself isn't going to help reduce or improve your gait and balance, though.
Okay. Let's talk about medications and their risk as it pertains to falls.
So medications are, of course, the third risk category, and they are in themselves quite a significant risk. As a matter of fact, just taking more than 4 medications, and I don't know about you, but I personally take, it includes both over-the-counter and prescription, take over 4 medications. So that in itself is a risk for falls. So I don't advocate that anybody just, choose their 4 favorite pills and throw out the others, but I do advocate that you go and talk to your doctor, talk to your provider, your pharmacist, make sure that every medication you're on is for a reason, that you know what that reason is, and that those medications are regularly being reviewed and assessed for appropriateness.
Are there any kind of medications that the senior population use in particular that are put them more at risk than others?
The worst offenders are the medications for anxiety and sleep, and those are often some of the ones we have the hardest time getting people to transition away from. Again, it's about having a conversation with your provider. The answer to everything really isn't a pill. You don't need a pill to go to sleep every night. You don't need a pill to get up every morning, and when people start to understand that and know what other alternatives are that are out there, it's a great place to start eliminating medications.
What about blood pressure medications?
Blood pressure medications are important, but blood pressure medications need to be monitored for appropriateness. So we do have to worry about people getting over-medicated, getting dizzy because their blood pressure may be too low, but we also do have to worry about controlling their blood pressure to prevent heart attack and stroke. So it's a balancing act, and that's why I really encourage just frequent reassessment with your care team.
And making certain that the medicines you're on are appropriate, and your doctor knows all those medicines.
Yes, you should be bringing your medicines to every visit.
Okay. Thanks, Dr. Frank, and thank you for being with us on Healthline today. Stay with us. We'll be back, and we'll continue this discussion on falls and falls prevention.